If you're watching this webinar because you have a teen or adult with Rett syndrome and you're feeling anxious or lost about this transition, I want you to pause and first realize what a great job you've already done in raising your extraordinary child. You've educated yourself about the diagnosis. You've made it through many years of school, IEPs, regression, and progression of this disorder. You may have faced some significant health issues in your child, maybe some medical procedures, and even multiple hospitalizations, all while juggling work, life, and family. So I want you to take a moment to celebrate how far you've come and all that you've accomplished on this journey. Understand that you are already a skilled and practiced advocate. You know that building a team to share responsibilities and decision-making, that planning ahead for a variety of scenarios is the key to your mental and emotional health, as well as the health and wealth of your child. We know that with decades of better understanding of the natural history of Rett syndrome, with strong early intervention and better symptomatic treatments, we've improved longevity in Rett syndrome. It's not uncommon, and we need to plan for a life well lived into 20s, 30s, 40s, and beyond. We know of some that have reached their 70s. Let's embrace this success and better understand our role in their successful adulthood. Today, we welcome Dr. Jessica Nickrand with the Child Neurology Foundation. She's going to share some tools and approaches that CNF has developed to help caregivers and care teams prepare and manage the transition from pediatric medical care to adult care. We enjoyed having Jessica with us at the Ascend Summit in Nashville a few months ago, and have since refined the talk for increased relevance to our Rett community. And we will be working with CNF in the months to come to modify and adapt their toolkits to more specifically support our Rett syndrome community. We know time is of the essence, so I'm happy to now turn the stage over to Jessica to share important information that will help you today. Thank you for submitting questions in advance at the time of your registration. We'll be addressing these throughout the presentation, as well as attacking them at the end for those that weren't addressed in the presentation. And we invite you to ask additional questions in the QA field, and we'll take those again at the end of the presentation. So Jessica, let's please turn on your camera and get your slides up, and we'll get started with today's webinar. Thank you.
Well, thank you so much for that introduction, Paige, and thank you again to IRSF for having the Child Neurology Foundation back again to talk about the medical transition into adulthood. Everything that Paige said, I want to just copy and ditto. You know, it's fantastic. I think what we recognize is that there's a lot of things outside of our control in the medical transition, and a lot of you parents and caregivers are already doing so much. And essentially, we're asking you to do one more thing here. But what we're hoping to do today is really to put you in contact with some of the tools and resources that hopefully feel empowering to you, so that we can lean into your child or your young adult's adulthood, because as Paige said, it's coming. You know, let's lean into those successes and let's plan for your child with Rett syndrome's adulthood before the decisions are made for you. And we'll talk a little bit more about maybe what that might look like. A lot of what we're going to talk about today is US based. I know a lot of you are calling in from places outside of the United States. There are still many things that are applicable, of course, because again, the tools are more focused on resources and conversations that you can have with your young adults and their care providers as well. And as Paige mentioned, and I just want to amplify that our relationship in this space will be only growing between our two organizations. So while we're hoping that for those of you who are with us in Nashville, we're hoping this gets a little closer to meeting those specific medical transition needs that you're having, but watch the space, because over the next year or so, we're hoping these resources are even more applicable to what you and your family need to have a successful transition of care. For those of you who are not familiar with the Child Neurology Foundation, first, though, I want to start by telling you a little bit about who we are. We're a patient advocacy organization that serves the entire child neurology community. We call ourselves disease agnostic. And so we estimate that in the United States, there's about 1 in 5 children who have a neurologic condition, and we serve all of them and their families. The Rett syndrome community is certainly part of that. But one of the difficulties that we have, of course, is when you're trying to serve everybody, sometimes the resources aren't specific enough, hence our budding relationship with IRSF. But, I want to just note that if you scan the QR code on your screen here, you'll be taken to the Child Neurology Foundation website, where you'll see that we have education and programming and different opportunities for research, different clinical trial opportunities that we advertise to our community, different support groups, things of that nature. So I encourage you to visit, and I'm happy to follow up with you if you have any further questions about who CNF is or what we do. And so Paige noted in the beginning that this is the first in a series about transition of care, and this is focused specifically on the medical transition for your families with Rett syndrome or experiencing Rett syndrome here. And so when Paige and I prepared this talk for the Ascend Summit in Nashville, Paige reached out to folks in this community who have gone through the transition or who are currently going through the transition, and learned their stories. And what we found, frankly, is that, essentially what we were just saying, that the system is really not built for transition of care generally. And it's certainly, not really built for people in the rare disease community, unfortunately. And so while CNF, IRSF, and our different partners are continuing to advocate, continuing to try to change the system, again, in the meantime, the hope is that these are some tools and resources that can help you as the situation is now, so that you can go in prepared, you can go in, ready to advocate. And unfortunately, all of us who have been around the block a little, long enough, realize that clinicians tend to react more to certain language cues, to certain ways that you say things, certain asks that you have. And the toolkit really is that we're going to present soon, is a way to learn some of that language and have a guide for that conversation in a way that hopefully when you go to your child's clinician or to the adult clinician that they will see once they make that transition and that transfer, it'll sort of click of, okay, this is a parent that's prepared. This is a family that's here to be ready for it. And it's a shame that sometimes we have to take on that ownership of that ourselves. But again, we're working to change the system and trying to exist here in the meantime. Paige, before I go on to the next slide, is there anything that you'd like to say about these quotes or any of the families that you talked to about the transition process?
Yeah, I want to say that these particular quotes are more from the angst side of our community, but we also have members in our community who have shared some positive experiences. We'll share some of those quotes in a bit, but I think leading with anxiety is a good transition into the information that we can help these particular parents have a better experience. So I want to thank those parents for being strong enough to share their experiences, because if we don't get real, we can't get better, right? So
absolutely, I love that slogan. Let's keep that mantra as we continue on our slides here. So I alluded to a toolkit without actually showing you what it is. I apologize. Sometimes I get a little excited about what we're about to present before showing it to you. But at Child Neurology Foundation, maybe half a decade ago or so, we convened a group of national stakeholders, many people from different backgrounds, so adult clinicians, child clinicians, parents, young adults experiencing neurologic conditions, to put together a transition of care toolkit to do what we just talked about, giving you the tools, giving you the language to have the conversations with the entire care team, to make this transition of care a good one for your young adults and your family. In a lot of ways, this toolkit is a way to just have a conversation, and have that conversation frequently, so everybody's on the same page. And if you scan this QR code here, you'll be taken to the place on the CNF website where we have it. It's a fillable PDF. You can also print it if that makes more sense to you and your family, whatever way that you want to have it work for you. In many ways, the toolkit also operates like a choose your own adventure kit in some ways. Some of the things will not apply to your family. You might need to add more things. You can really take and leave what you don't need. But again, it's just a start. And as Paige mentioned, we'll have more specific Rett syndrome parts of the toolkit soon that hopefully will make more sense for you as you go through it. I want to emphasize, though, that I think we talk about transition of care as though it's the end. Here, your child's, first part of their life happens, then transition of care happens and ends, and then you're an adult and you're receiving care. In a lot of ways, the transition of care is just part of the continuum of care over the individual with Rett syndrome's lifespan. It might be a more intense period of what that care looks like, but it is just a part of the process. And so I hope maybe that makes it feel a little less scary. It's not this gigantic mountain that we have to scale and then it's behind us. It's more like a bunch of maybe like little hills for a long time. And again, hopefully this toolkit can help you, and we can talk more. We'll talk more about what specifically is in the toolkit as our presentation continues. Before we get to the ins and outs of the toolkit, though, we want to make sure that we're all operating from the same place and making sure we're on the same page with what these different definitions are. So we've talked about transition of care, and what that means is the process of discussing your young adult's transition to adult care, but the transfer is when that transition is complete. So the transition of care process is many years, most likely, whereas the transfer might just be a moment when the computers are cleared up, when the packet is handed over. So the transfer is when that piece closes up. Medical home is a term that you might hear us use. And there's a lot of different medical homes that you might hear of, but what we're meaning in this particular space is not the physical medical home. It's not a group home or something like that. Instead, it's more of the sort of philosophical home for where your young adult or your child's care is. One of the things in transition of care that we hear all the time is that in our community, for children with neurologic conditions, particularly in the rare community, the medical home is typically a specialist, whether it's your pediatric neurologist, your pediatric cardiologist, whatever the most prominent of the specialty needs that you might have, that is your medical home typically. The doctor you see the most, the doctor who is your biggest advocate, the person who puts all the pieces of the puzzle together. And in adulthood, it's typically your primary care provider. It's obviously a big change generally, but particularly again in this rare community, our adult primary care providers might not know the ins and outs of Rett syndrome, and so that can be a challenge. The rest of the definitions here are more of the legal categories that we might see in our community. So for this talk, we're going to focus mostly on taking sort of an aspect that guardianship is probably the most likely scenario for your family. So guardianship, of course, is when there's a court-appointed individual to make legal decisions on behalf of the individual with a rare disease. These decisions include, medical decisions, training, education, finances, things of that nature. But there are some other options that we just want to make sure everyone's aware of, including a conservatorship, which is the financial and sometimes the financial portion of guardianship. Durable power of attorney is when somebody is appointed to make decisions financially on someone else's behalf if they are no longer able to do so. Healthcare proxy is similar to durable power of attorney, but with healthcare. And you might have heard people talking about adult wards of the state. That's another form of guardianship in a way. But it's instead of being under the care of an individual that has gone through the court process, it's when an individual goes under the legal protection of the arm of the government, usually the state in which they live. And for some families, this is an option in terms of getting particular healthcare, things of that nature. So sometimes people can choose to have this happen. Sometimes people have it happen when the decision is made for them. And so the other thing that is important, I think, to talk about here is that we are not advocating for a particular legal pathway for you and your family. We're not saying one is better than the other, but what we are hoping to impart onto you is that the legal discussion is crucial to making sure that the medical transition happens the way that you want to. And if you're not planning ahead of time in the case of emergency care or something outside of your control that happens, you become incapacitated as a guardian. These decisions might be made for your family. And so the more that we can plan ahead of time before your child becomes an adult, the better off you will be, the better off your family will be, and the better care your individual with Rett syndrome will receive. So getting back to the toolkit, as Paige mentioned, adulthood is coming. And I know for folks in the rare disease community and in the Rett syndrome community particularly, it can be hard to hold that tension while you're very focused on the day-to-day care of your child or of your young adult. But we have to plan as though that the adulthood will happen. And we hear stories all the time of somebody who becomes 18, 19, 20, has a seizure, falls down, something like that, needs to go to the emergency room. And because the transition process hadn't yet begun or wasn't finished before that magic wand waves on the 18th birthday, that person might not be able to be admitted into the pediatric ER. And then that transition process and that transfer process is made outside of your control. This isn't a blanket decision, a blanket situation. I want to state there are different states. Different states have different levels of like ceilings of when this age can happen. But just because your state might say that you can go to the pediatric hospital until you're 21 or whatever it happens to be, doesn't mean that the individual hospital that your young adult might end up at doesn't have an individual policy of 18 being the cutoff or something like that. So it can be particularly tricky, especially when pediatric physicians might be saying to you, don't worry about it. I can stay and I can keep watching them and caring for them forever. Those adult neurologists don't know what they're talking about anyway when it comes to Rett. It's really tempting to just say, okay, we're going to just keep things as they are. But there's so many things outside of our control and so many potential situations that might arise beyond those physicians who say, even though I'm a pediatrician, even though I'm a pediatric neurologist, keep them coming. It's really that emergency care part that can get really dicey. And that's the biggest reason I think that we're trying to impart to you all that transition of care is something that we really need to focus on in every family, regardless of your circumstances. The way that you start this conversation is by taking this transition. Oh, whoa, sorry, I moved my mouse. But the way that you start this transition conversation is by taking this checklist that if you scan here, you'll find to your child's clinicians and saying, it's coming. They're 15, 16, 17, whatever age makes sense for you to start this conversation. And to just start saying, you can go and say, I'm afraid of what happens if they need to go to the emergency room and the EHR sees that they're 18 and they transfer them to the adult care, or we don't have our guardianship figured out, things of that nature. And your clinician, your child's clinician will help you have these conversations, will help you make these policies. And of course, CNF and ISRF are always here for you as well. If you go on our website, I just want to call out that CNF identifies that this conversation should happen at around age 13 for your young adult and happen annually after that. Again, I want to reiterate, we are an organization that serves the entire child neurology community. And so that might feel too early for you, and that's fine. There's no right way to do this other than to make sure that it's happening and to make sure that this is a conversation that you, your family, the secondary caregivers, the individual with Rett syndrome, and their clinicians are all having, so everybody is on the same page here. These are some more quotes that Paige gathered from families about the expectation of transition. And at this point, I'll hand it over to Paige to just talk a little bit more about some of the emotions and feelings in the community about what transition means.
Okay, thanks, Jessica. And I think it's really good to look at the broad level, high level needs, but it doesn't really resonate until we bring it back home and hear from actual parents who have been through this journey and have shared with us some of their experiences. So for example, this first quote is from a family whose child has Rett syndrome. She had Rett syndrome at the age of 2. She has the Rett syndrome at the age of 30. She's had a neurologist on her team. But the type of neurologic issues that she had changed from pediatric to adult. So even though she had a neurologist who maybe she was comfortable with talking about seizures, she now not only needed to move into the adult space, she needed to be talking about different symptoms. And that is our life with Rett syndrome, right? It's multifactored. Our children aren't static, their disease progression is not static. And so we are going to be continuously moving through systems, but we're also going to be continuing to evolve with our child. and we need to be able to flex and adapt to that environment of where we live and the services provided, as well as what's going on with Rett syndrome. So this particular family found that her community didn't have a good med-peds transition program, and she kind of found a home in the geriatric department. Not something you want to do when your child's 20, but she found that it worked. So sometimes when you might have an emotional reaction at first, try something on, see if it'll fit. You're going to find some wonderful providers, just as you did in your child's early ages. You found some of your best advocates in the least likely places. You may find the same thing will happen in adulthood. So try not to resist, try not to make snap judgments, give people a chance. And as Jessica is saying, do it proactively so that you have the comfort of time to make that transition before it needs to happen for you. Okay, and again, just another quote from a family who has, experienced that it feels like the system expects her to be cured by age 22. Well, as of we're in the works for that, but as of today, that's not where we're at, and the system just isn't quite ready to continue that continuation of care. So, again, centers of excellence, the IRSF, Rett Syndrome Centers of Excellence across the country can be great resources for you to help with this transition beyond your GP or your pediatrician or your local hospital. So we'll talk more about Centers of Excellence later, but thanks, Jessica, for letting me share these families' experiences.
Oh, absolutely. Like you said, I think it really does just bring it home. We were talking about things that are so up in the ether, and so to recognize that this is something that that folks are dealing with, folks have dealt with. And to your point, Paige, there's never one right answer. Again, and we're not trying to say there's one right answer here, other than talk to figure out what works best for your family. Something, though, that in the Rett community is necessary for medical transition to occur in the way that it should is to start thinking about that legal transition. In most cases, Rett syndrome families will need to explore guardianship or something similar to make sure that there is somebody able to legally make decisions on behalf of that individual experiencing Rett syndrome. That doesn't mean that the individual living with Rett syndrome is totally out of their decisions, but because of the way that our system is set up, if somebody is having an emergency, if there needs to be paperwork signed, somebody needs to be there. And again, if your child becomes an adult, if they turn 18 or 19 and have an emergency and need to go to the ED and that guardianship doesn't happen, that's where sometimes becoming a ward of the state can happen against your wishes or not as part of your plan. And so thinking about how to talk with your child's doctors, and how to make their care work later, you also need to think about what that legal situation is going to be for your family. Frankly, in talking to Rett syndrome families, as Paige did, it seems as though this is one of the better parts of the transition process. Better meaning more straightforward. I'm not saying that to mean as though there's maybe not still emotional difficulty around it or actual logistical difficulty. But there's a lot of resources around for folks who are working on getting the legal transition piece for their family working, whether it be guardianship, whether it be conservatorship. It takes a while, but the process itself is a little bit more straightforward. And so the best advice we can give around this area is that, you want to, again, know it's coming. So be prepared. Figure out what the rules are in your state. Every state is different, or in your country, whatever your situation is. It's hard to say across the board, do this at this age, or make sure you're going to this particular court, because it's going to be different. But there are state reps that IRSF has that are able to help you in this situation. There are state caseworkers for Medicaid, things of that nature. And oftentimes, if you are employed and you have an employee assistance program, sometimes you can get a program like Legal Shield or Legal Zoom, one of those sorts of things, if you might have heard those phrases, to start this process, to start figuring out exactly what you need. DIY guardianship is a choice that a lot of people make, but it's one of those things that the money that you save is going to be taken up by the amount of time and organizational skills and your management and capacity required. So Again, no right answer, just making sure you figure out what works best for you, your family, and the capacity that you have. One of the things that it feels so important to talk about when we're talking about guardianship and conservatorship, things of that nature, is to start thinking about secondary guardianship here. In most states, if you put a secondary guardian on this paperwork when they become 18 or whatever age it is in your state, that secondary guardian will, when that secondary guardian becomes a primary guardian, you might not have to redo it. And so thinking about when you are unable as a parent to be the primary guardian, who are you going to bring, who's going to be the person that's responsible? Is that a sibling? Is that a friend? If you've thought maybe it was your own parents or your siblings, aunts and uncles of the individual with Rett syndrome, that might also change as they age. And so again, there's not a right answer, but again, having the conversations around transition, what the needs are, you can all go on this journey together so that suddenly there's not a lot of confusion or a lot of lack of continuity of care when you are no longer able to be the guardian. And again, the biggest piece of advice we can give is figure out what the situation is in your home state or in your home country, so that you have all of the forms that you need and allow yourself some time to make this happen. We mentioned that just because guardianship is the most likely case for families of Rett syndrome doesn't mean that the individual with Rett syndrome should be or is out of their own decisions on what happens in their adulthood. And so one of the ways that we can make sure that that happens is practicing supported decision making. Supported decision making is just a fancy name for essentially making sure that the individual who is being discussed, whose medical needs are being discussed, is present. So, and people, regardless of disability status or intellectual disability, particularly participate in social and supported decision making all the time. This can be role playing, something as simple as role playing, something like developing a pro-con list, something like taking medical notes back to be a little bit more plain speak. And some states around the United States, I'm sorry, this is a pretty American-centric suggestion here, but some states have a set of laws and a set of policies in place that allow supported decision making as a legal alternative or complement to guardianship. And so if you scan here, it'll take you to the National Resource Center for Supported Decision Making. You can click on your state and it'll tell you what's on the books and what sort of resources are available. But again, even if you live in a state that doesn't have formalized supported decision-making laws, it's still a process. It's still something that you can do to empower that individual. So once you've gotten that legal transition taken care of, let's focus and shift back to the transition of care toolkit at CNF. So you figured out what the legal adulthood would look like. This helps to figure out what those medical needs will be in the person's adulthood with Rett syndrome. So this toolkit, again, as I mentioned at the beginning, is really just a way to have a conversation, a way to guide the language about what a person needs. And if you're having that legal conversation of who are the caregivers going to be, who are the resources, this is a really good way to bring folks into that fold to go through the entirety of what the medical needs are. So if you scan, we'll start with I don't even know why that's doing that. I'm sorry. We'll start with the one on the left. And if you scan that QR code, you'll see the medical summary of the transitioning patient. This is something like 5 or 6 pages long. And this allows you to list all the medications, all the DME needs, all the therapies, past surgeries, allergies, pretty much everything. And in addition to you putting it all down on paper as the initial caregiver, it can be a tool to help the individual experiencing Rett syndrome learn more about their own condition and their own needs. And again, those secondary caregivers and those who will become primary caregivers once you are no longer able to understand what those needs are. If you revisit it annually, even beyond transition, it allows everyone to see what those changing specifics of that medical needs are as well. The plan of care is on the right. You can scan it and get that part of the toolkit specifically. And what the plan of care does is summarize that medical summary and say, this is what matters most. So, whatever those goals happen to be from your medical summary, whether it's experiencing fewer seizures or, making sure that there's always DME available or something like that. Whatever those goals happen to be, you can identify what goals are most important based on either an individual's medical needs or, their outside of medical goals, frankly, too, and kind of get a roster of what needs to happen, who needs to be called, who's in charge, things of that nature. And again, it's just another tool to make sure everybody's on the same page so that the care is most streamlined and best for that individual with Rett syndrome, but also so that you as a caregiver can start delegating and can start using your resources in your community a little bit better to provide better care for your young adult. This is very similar to the last slide in that in addition to having medical summaries and a medical plan of care, the toolkit also involves a self-care assessment. And so we really encourage folks to assess the self-care needs as well annually as the medical needs. And there's two different versions here, one for parents and caregivers to fill out, one for the young adult to fill out. Of course, depending on what's able to happen in your family, you might not use both of these. But again, having your individual with Rett syndrome be a part of this is really important. It identifies whether, choices can be made on your own, whether, what sort of things that you want out of your life and how important it is to you. And so again, not everything's going to apply to families with Rett syndrome on these, but again, it's a way to start having the conversation about what are the goals for the individual as they experience adulthood. What are those social needs? Things like a work program. I know that's really difficult, but this is a way to parse out if that's something that really matters to your young adult, and if there are ways that you and also your friends at CNF and IRSF can make that happen. And so in the same, while we're talking about the medical transition, and there'll be other conversations coming up on these webinars that talk about other parts of the transition, we want to acknowledge that in some ways, these conversations need to happen in tandem because it's, especially in these types of communities, it's possible that there might need to be medical intervention or medical assistance to make some of those non-medical transition goals happen. So bring the clinicians into the fray or the therapists into the fray as soon as possible to start thinking about what those lifestyle and self-care goals are as well. As you get closer to transfer, the transition toolkit also ideally will be topped off with a transition package that you can hand over to the adult provider or providers that you've identified for your young adult. Now, we know this is incredibly difficult, right? That it's a rare disorder. And so finding doctors in general can be really difficult. Finding adult providers can be even more difficult. So we encourage you to use your resources. We talk to other folks, see what happens. We encourage you to think about incorporating telehealth. Maybe if you see a meds peds person for the primary care provider, those specialists can be further away and that you see mostly via telehealth. Again, there's a lot of different options to figuring out what works for your family. I also want to come back to something that we said at the beginning, that transition of care isn't something that you accomplish and then shut the door and never revisit again. It seems kind of scary to say that you can do it all over again, I know, but hopefully it also feels empowering that if an adult provider is chosen and for whatever reason it doesn't work out for your family, this process can happen again. Even though when we're talking about transition of care from child to adult care, transitions happen all the time across the continuum of care for all patients, regardless of condition, regardless of disability status. And so we can start the transition again to find something that better fits your needs. At this time, I want to pause and just let Paige talk a little bit about the Centers of Excellence model, because that seems to be a really interesting and fantastic thing in this particular community around finding adult providers. And I want to make sure everyone's aware of it.
Thank you, Jessica. And, everyone, in the US, we've had the benefit through IRSF of helping build and support the Centers of Excellence clinical research network across the US. We have 14 growing to 18 centers of excellence. Not all of them are located right in your backyard, but we hope that the breadth and expanse of the Centers of Excellence network allows you with some reasonable effort to get into one center of excellence where your child can be seen, known, and understood. All of these centers of excellence will see your children as adults. So does that mean that they can admit them to the hospital if they're at a children's hospital for a procedure? Does that mean that they can be responsible for her day-to-day care or his day-to-day care? Probably not. And that's not a fair expectation of those centers. But what you can expect is that they are very well versed on the needs and the common symptoms that might come up due to Rett syndrome versus their other physical needs and medical needs for all of the other things that happen with us through life as we go into puberty and become adults and need to get checks and screens. They can be a great person to call into conversations, whether it's through a telehealth appointment or a doctor-to-doctor conversation to support your local care team who may not be so familiar with Rett syndrome, right? But you might find a provider who accepts your benefits or your insurance plan, who is easy and accessible in your town, but may not have a lot of familiarity with complex care or with Rett syndrome. And that's where this team approach is required. So although your child may not have a lot of medical needs, or you might find it, oh gosh, it's really hard for me to get to that center of excellence, I really strongly encourage you to look at our map on our website and find the one closest to you and make the time for at least one appointment. If you can go annually so they can continue to get to know your child, it will serve you even better as they age and go into adult care. Again, they may not be able to do direct care, but they can consult and help you in explaining Rett syndrome. It's complex. Build a team for you and please use the centers of excellence. There are also the locations for clinical trials. So it's not something that Jessica is necessarily talking about, but that's absolutely a dimension in the medical care that we're all looking at and wanting to participate in, which is clinical trials. And a lot of that also has to be dependent on guardianship, conservatorship, benefits, travel, and the entire spectrum that gets involved when you're dealing with a specific medical issue can also come into play when considering how to enroll or what clinical trial to enroll in. So that's also an aspect where the centers of excellence can help best guide you. So thanks, Jessica. I hope that answers. Give another team member that you can invite to the team to help you in this process.
Absolutely. Thank you so much, Paige. And yeah, it's very difficult. And so having centers of excellence models, having things like clinical trials for different therapies, all a piece of the puzzle. And again, not one right answer. We're just trying to give you a variety of different options and different suggestions for figuring out what works with your particular family's needs. We would be remiss if we didn't take a minute, though, to talk about one of the most important, in my opinion, and one of the most overlooked aspects of the transition of care for young adults with Rett syndrome, and that's your health and well-being as a caregiver. This can be as literal as thinking about, what does your insurance look like? Does your insurance come from work? And if so, do you ever want to retire? What does that look like for you? Thinking also about your own transitions in your life and how to take care of yourself are really important. And I know extraordinarily easy to overlook as a caregiver at this time, but from an empty vessel, you cannot serve. And so the more that you can also try to take your own needs into account during this, the more successful the transition will be. Things like disability income for your young adult, how does that change as they age? How does that affect different insurance needs, all that sorts of things? And I know that we're having different webinars about these issues more specifically through IRSF in the next couple of months. So please be sure to watch that, because again, it also, even though we're talking about transition in different aspects and it feels kind of siloed in this way, they really all play together. And so trying to think about how different changing financial needs change for your family and for you as you age are really important. And also, we've mentioned this a few times during this talk, but it does seem to be one of the more difficult things for caregivers to talk about. How does that care partnership as the individual with Rett syndrome age change for you? Because as they age, you as a parent or as a caregiver will also be aging. So maybe your own parents as grandparents are aging out of their abilities to be care partners currently. You will probably eventually age out to be a care partner for your child or young adult with Rett syndrome. So again, thinking about what that means. Are there siblings involved? Are there family friends? Again, no right answer, and everyone's network and everyone's resources are different. But it's important to be thinking about that and recognizing that you will have needs as you age as well. And your capacity to care give will be lessened in that respect as well. We want to just close by advertising again. This is something that those of you who are in Nashville might recognize, or those of you who are familiar with CNF might recognize. A couple summers ago, we had a Transition of Care Summit, and one of the talks that we had was about how to advocate as a non-speaking patient, and it was many Rett families who participated and shared their stories on transition of care. And so if you scan this QR code here, you'll be taken to this video that's fantastic. And even though it's a couple years old, again, you know, a lot of the stories still hold up. A lot of the stories are still the same about how families navigated the systems, what they've learned, and what they want to share with other Rett families. So really can't recommend you checking it out enough. And so finally, I just want to give you one more resource, and that's our entire Transitions of Care resource hub, where you'll find more videos like the one we just mentioned, and also share my email address. It's jnickrand@childneurologyfoundation.org. I'm also happy to put it in the chat box if that's easier. You can reach out to Paige as well and Katie with questions, and they will let me know if it's anything that's applicable there. But I thank you so much for your time. And I know this is really difficult. I know this is an extraordinarily big ask of caregivers who are already doing so much, but please use your resources both at CNF, at places like IRSF, places like the Association of University Centers of Disability, the ARC, NORD, Global Genes. There's a lot of different places out there who offer sorts of resources like that. And we're all ready and willing and excited to help you and empower you to in this transition process. So thanks so much. And I think we've got some time for discussion and questions.
Yeah, we sure do. Okay, thank you. Thank you so much, Jessica. And
yeah.
Gosh, we are doing great on time. So we have some time to take some questions that were submitted at the time of registration. And for those of you who are online now, if there's a burning question that you have or a clarification on any of the things we presented today, go ahead and pop them in the QA field and we'll address them. And of course, this is not a one and done type situation. So if any questions come to your mind after you watch today's presentation, feel free to email me or Jessica, as she said. Okay, so thank you, Jessica. We're just really so impressed at Child Neurology Foundation's commitment to building toolkits and tools that help people manage the medical care, right? Especially if we've all become sort of pseudo-professional medical professionals through the decades of caring for our child out of necessity, but that still doesn't mean that we don't have holes of knowledge. And I think that the most important utilization of the toolkit from the Child Neurology Foundation is what I'd like to see is that parents, caregivers download this toolkit and use it in every specialty. So you'll find that, as Jessica said, some of those toolkit questions may not be relevant to our child with Rett syndrome, right? For the most part, we're talking about our children still being dependent on us for managing all aspects of their day-to-day life, as well as making decisions, both financial, legal, medical, quality of life. We want them to be part of the conversation, but the reality is somebody is going to need to execute all of these decisions every day. Having organized records is super important. This toolkit, although some of the questions won't be relevant for you, just cross that one off. Take the ones that are relevant with you to every appointment, starting in their teen years, to begin the conversation. Again, to be proactive will help manage your way through some of the things that are not in our control. So whether it's with your neurologist, your pediatrician, your gastroenterologist, your orthopedist, your therapy appointments, this toolkit will help you in all of those areas. So just download it, print it off, and take a look. And then you can consolidate and roll up all of the different toolkits into one master. That would just be a tip and advice. So thank you again to the Child Neurology Foundation for helping pave the path in many aspects of our kids' lives. So with that being said, what I'd love to do is go to some of the questions. So we have one in the queue right now. So Jessica, let's start with that one, and then let's go to some of the ones that were submitted while others are writing in.
For sure. So for those of you who might not see where the Q&A area is, Donna's asked about finding doctors and asking if there's a good way to vet prospective doctors other than just going to a lot of appointments, and shares a bit about the difficulty in waiting periods and maybe different providers not really knowing what Rett syndrome is and offering therapies that don't make a lot of sense. And, what I can say from our perspective of what we hear at CNF is, and maybe this doesn't help, but you're not alone. We hear this a lot. And again, as a condition that is rare, what we hear a lot is that transition of care is so difficult because adult neurologists might not have the education, the comfortability with rare diseases, and Rett syndrome is one of those situations where it becomes really difficult. So as far as the actual responsibility and onus on caregivers and how to find doctors, I don't have any great suggestions on how to vet other than going to different appointments. What I will say though is their telehealth appointments are an excellent way to do this. So instead of getting yourself and your family in the car and packing everything you need and driving long distances and parking and going through the campus and whatever it happens to be, having a quick 20-minute telehealth appointment from home just to get a, for lack of a better phrase, a vibe check, so to speak, might be a good way to do that vetting a little bit earlier. Using your network, asking other folks through your state rep who they go to, what works, utilizing your resources at IRSF, things of that nature. And of course, the online, like, it might not apply for this community, but online reviews are pretty truthful and you can get some information there. Paige, is there anything else from IRSF or from your experience as a parent that you can share about this?
Yeah, I acknowledge the reality. I think that this was a reality. This is always a reality for us, whether our child is 2 or 20, that we will have change in providers. And it can come from the fact that they might age out, or they might retire themselves, right? Or they might move practices, or your insurance changes, or we move and change. So all we can say for sure with Rett syndrome is that change is the constant. So how do you minimize? I think, Jessica, you gave some really great recommendations, which is network with other families in your area, utilize the IRSF Facebook state pages to just throw out questions. There are people in your community who may not be in your neighborhood, but are in the community and might give you a good reference. Another good point is the use of telehealth, right? It is here. So if it is difficult, especially as our children age, it can become more difficult to just pop in the car and get over for an appointment. As our careers move on, you're very limited in the number of times you can take off of work to get to different appointments. So you want to minimize change, utilizing your network for recommendations, utilizing your centers of excellence to help educate new providers. If you don't have current provider, right? So what Donna is saying is she's now on her 4th neurologist. She probably lost the knowledge center from that first transition and is now back in a place where she's feeling she needs to start all over again on this 3rd or 4th neurologist in the adult realm. We have resources to help. We've got primary care guidelines that are relevant for the adult as well as the child. We have centers of excellence who, if they're familiar with your child, can help with that transition. And you can use telehealth to have a paid visit to do some of that early vetting. It's not a perfect situation, but hopefully those are some tips that can help. Okay, why don't we take one that's that was pre-submitted, and then we can go back to the queue.
Great.
Okay. One of our attendees wrote in and said that they're confused about when to apply for Medicare and Social Security. So good news, on September 27th, our part 2 in this 3-part series, RettEd, is going to be on legal, financial, and benefits planning. So we're going to talk more about the nuances of Medicare versus Medicaid and also Social Security, right? So some of these benefits are dependent on your income, you as a family, as a caregiver, and some of them are automatically made available to your child based on their diagnosis and their condition. And so we'll go into more detail on that on September 27th. We appreciate that question. Jessica, did you have anything to add?
I don't. I'm looking forward to learning as well on those webinars.
Okay, great. Let's see. Why don't we take the next one in the queue?
Okay. Are either of you or anyone else taking questions aware of any threats to private duty nursing resources sometimes available through Medicaid? I believe it is being administered differently per state. So I will just own up and say I am not. And to Ruth's point here, it is administered differently per state, which means, you know, the best advice we can always give you is to check with your state care worker or caseworkers. Maybe this is something the state reps from IRSF would help with. I don't know, Paige. But you know, unfortunately, it's always the non-answer of like check in your own state and those individual state resources. Paige, do you have anything to add to this particular question?
Yeah, I wish I could say on this specific case that I could answer, but unfortunately, there is so much variability state to state, and also as the economy ebbs and flows, the amount of funding or the number of people accepted onto waiver programs or that states are able to provide resources for does change. So, you know, again, on September 27th, part 2 is shoring up your financial planning as well to be able to compensate for changes in public services. Is important. Not always something that all of us can provide for, but there are ways to protect your private funding that can partner with public funding as these things change. So I can't speak to directly what's happening with private duty nursing, but staying in contact with your case manager, staying in contact with other families in your community will kind of give you the heads up through the network of any impending changes that might be coming on the horizon.
And Paige, do you mind if we take the next question here in the queue, rather than one of the pre-submitted ones?
Yeah.
Is that okay with you? Okay.
Yeah.
This question is, those with Rett are often of small stature. My 20-year-old is the size of a 10-year-old. How do we decide if a general hospital can manage her surgeries as effectively as a pediatric hospital? And as far as the actual answer to your question there, I can't necessarily speak to that. Maybe Paige has experience as a parent and as someone who works in the Rett space professionally in that way. But something that we just want to underscore is that sometimes you don't get to make those decisions. And I think that's what we're trying to impart here. If a surgery, if, you know, whether or not your child or young adult still goes to a pediatric physician who operates at a pediatric hospital, there might be policies in place, whether it's at the state level or whether it's at the insurance level or at the individual hospital policy level, that your 21-year-old, 26-year-old, 30-year-old might not be able to receive care at that pediatric hospital anymore. It's different from a day-to-day thing. I know maybe your pediatric physician can still provide care, but when it comes to hospital admissions, particularly for emergency care and for surgeries, sometimes those decisions are out of your hands, unfortunately, particularly if the guardianship and or the conservatorship is not in place. So as far as like more specific answers there, I unfortunately don't have that other than to say, you want to make sure with your, not only your child's physician, but also the hospital that you're going to and the state that you live in, that is even an option, that your 20-year-old or older is still able to receive care and receive surgery at the pediatric hospital. Paige, do you have more to add to that?
Yeah, other than to refer back to your toolkit, that this is a very important question to ask your current providers to provide their best advice and their best recommendation for the size of your child and what level of care, because you're right, the instruments in adult setting may not fit. The blood pressure cuff may not be ideal. All the kinds of things that are used for monitoring and for procedures may not be appropriate. So there could be concessions in your area where admission directly onto somebody's service for a procedure at a children's hospital may be advised and may be possible where it isn't for the general public. And again, you don't want the ED or the ER making those decisions because they're there for rapid intervention. They're not there for understanding necessarily complex care. So we encourage you have this conversation in advance, talk to your Center of Excellence for Rett Syndrome and see what the options are. But if it's documented in your paperwork, it goes back to Jessica's very first opening statement, which is if you approach whatever situation is sounding knowledgeable informed, using some of the lingo and language in the medical environment, you're going to be taken more seriously and you'll get people's attention and they will listen. It's just the nature of reality. So we hope that through these kinds of webinars and the toolkits that you'll become well-versed and can rapidly convey information in situations so that care is not delayed and appropriate care is given. Yeah, good question. Yes, we do know that most of our kids are of small stature and we worry about that in the adult environment. Yeah. Okay, well, we are at the top of the hour. We have a lot of really good questions. A lot of the questions that are submitted are about quality of life issues, accessing therapy into adulthood, because a lot of those services were provided in school and they drop off as you turn, as our children age, as well as, making that guardianship, conservatorship, understanding the complexity of benefits and how you can use them to your advantage and lifelong support. We'll be tackling a lot of these questions in part 2 of our RettEd series. And part 3, which will be on December 6th, is where we're going to have some families from our community come on and share exactly what their journey has looked like with all the blemishes and bouquets of this journey. So we're going to share some real life examples of things that have worked and things that people have had to manage through and came out on the other side with success, because we want everybody to be successful and to embrace this really beautiful next stage for your children. There are work opportunities. There are a variety of living options out there. They just can't materialize overnight. And again, using the communication guidelines, we want you to involve your child in the conversation. Let them express what kind of life they might want. They may be ready to move out and be in a residential environment with roommates, where you're visiting all the time and they get to come home on weekends and holidays. That's okay. It's an okay option to consider. It's terrifying. It's something that you feel like they're not ready for, but they might be. You won't know unless you have that conversation with them. We know that they have far more expressive language than receptive. Give them that courtesy and understanding and respect. Jessica, I think we should probably take, if there's 1 or 2 questions that were pre-submitted that pop out at you, let's take those. And then we can contact everyone who submitted questions offline if we didn't get to your answer today.
Sure. Well, I'll pick one here. Someone asked how we can make a teenager with Rett syndrome feel their best during those teen years. And I think the best answer to that, again, in addition to like using the toolkit and getting everybody on board, is really leading up to the answer being coordinated care. So making sure that the entire medical team is involved, however that medical team looks like for you, getting teachers and the school team involved, different case managers, different parents and other friends who have Rett syndrome. So again, find that community, make sure everybody's talking to each other, everybody's aware, experiences and responsibilities can be delegated that way. As Paige just said too, recognizing that your young adult is someone who has their own aspirations, their own goals, their own dreams, and doing everything that you can to make sure that you're supporting that happening. And that can start by asking them. That can start by involving them in the conversation with their clinician during their medical transition about what their living goals are like, what their work goals are like, things of that nature. And so to me, it seems like the best way to support a teenager with Rett syndrome is just to listen to them, to let them be who they want to be, and use the tools and resources that you have available to you to make sure that your whole team and all your resources are talking to each other to facilitate that and make that happen. Paige, do you have anything to add to that?
No, I think collaboration, teamwork, build your bench, include your child, try to be really sensitive and focused on what they want, and understand that compromises might need to be made for what they want and the resources available, and also what's realistic for you, and give yourself grace in this process, right? You didn't become an expert the moment that your child got her diagnosis or his diagnosis. It took time, but celebrate the accomplishments that you've made. When you're faced with having to make these difficult decisions, look back over the years and look at how much success you really did end up with. It may not have felt it in the moment, but most of us end up in an okay place, both for yourself and for your child. And understand that this can happen in adulthood too, whether you're in the US or in another country around the world. We can find therapies, we can find good medical care, we can find a good quality of life for everybody involved. It's not going to look like what we thought. We've understood that we've had to adapt our dreams over time, but good outcomes can be had. And we know that coming out of and we know with the current economic environment that finding healthcare providers, finding in-home supports, finding day programs is a little bit more challenging than it's ever been, but we can band together as a community. We can use our shared resources with the Child Neurology Foundation. We can use our state reps. We can use each other. We can use our centers of excellence to just find the best end for the moment of where we are. And we know that there's so much hope on the horizon with research and with the force of our advocacy. So really, let's utilize it. Let's band together. Jessica, I look forward to working with you over the coming year to modify the toolkit to really get something that utilizes people with complex needs. And I'm excited that Rett syndrome might be the disorder that Child Neurology Foundation works on to make sure that we can modify and serve this community better. We are at the forefront. We're at the cutting edge. We're going to make good things happen. So I encourage everyone who's attending today's call or watching the recording to please reach out to me if you'd like to be on a panel to work on the evolution of these tools, right? So let's use our real life experience to pave the path that we all have to continue walking and to improve the path for those that are coming up behind us, right? That's how we've done it in Rett syndrome, and that's how we'll continue to do it. Partnerships. Okay, so we are definitely at the top of the hour and at the conclusion. I know we did not get to everyone's questions, so please go to rettsyndrome.org, register for part 2 and part 3 of our 3-part series. And if we need to do a part 4, 5, 6, we are here and we are partnering. Our children now are living longer as adults with Rett syndrome than they did as children. And we can take advantage of this transformation to really create a life that suits everybody involved. Okay, so we hope you found value in today's session. Jessica, thank you for being with us. Thank you for your commitment and we appreciate you. All right. So my just last word of advice to all families is try your best to understand how to advocate for your child. Remain optimistic and replenished in your lives. If you don't take care of yourself, you can't take care of your child. And their success and their well-being really hinges on you creating a succession plan of care. And we hope that these tools really help you in that effort. Believe in them, believe in your kids, all be part of something very special. You can count on IRSF to bring you the latest news and information through a variety of channels and to continuously push for new and innovative findings. We hope to see you next on September 27th for our second webinar in the Adulthood series. We're going to be focusing on legal, financial, and benefits planning. Until we speak again, be well. Try out the Transition of Care Toolkit and know that we welcome your feedback on how we can modify this tool to best serve our loved ones with Rett syndrome. Thank you. And this concludes our webinar.